Hi there. Hello, Mr. Filipov.
Hello.
We're standing as opposed to sitting for a reason. I'd like to ask about exercises. I believe exercises are healthy. I wonder what a person with diabetes should know about aerobic exercises.
Yevgeny, to move is to live. Diabetes itself is not an obstacle for doing sports. There are Olympic champions who had contracted diabetes before their Olympic success.
Wow.
Aerobic exercises are the most predictable physical activity for persons with diabetes. One should bear in mind that aerobic exercises may or will, I should say, lead to a drop in blood pressure glucose level during the workout. Let's imagine a typical aerobic exercise. Take cycling. It's nice. Everybody likes it. We present it as a period with a beginning and an end here. In order to avoid hypoglycemia, and it's a possibility because as you cycle, the glucose level will be dropping, not only down to normal limits, but below it.
Does it happen always? Gradually?
Yes, during aerobic exercises, the glucose level will be lowering. It depends on the person. It may plummet in no time, or it may be dropping slowly and gradually, but it will drop. So if a person's daily routine and their insulin doses are adjusted so that the glucose level remains stable without physical activity, it will drop with it. To avoid hypoglycemia, and we don't want it because we will have to consume extra carbs, there will be unpleasant sensations, and there's a risk that the glucose level will rise above the normal limit after hypoglycemia. We need to check the baseline glucose level and decide whether you need to take carbs now. If the glucose level is too low, it's not hypoglycemic, but it's normal, close to its lower limit.
I see.
Then you should take carbs at once. If the glucose level is normal or slightly elevated, then you should take not fast but medium-acting carbs because they will be expended during exercises. And of course, no insulin should be taken. Then, during the session, you should test your blood glucose levels over equal intervals.
Okay.
Typically once an hour, especially if these exercises are new to you. For instance, you used to swim, but now you've switched to cycling, right? You should test your glucose every hour. If you find out that your glucose level drops to the lower limit,
And what if you develop hypoglycemia?
you should take fast-release carbs and stop exercising. For instance, you are far away in the woods, and there is a long way back home. Stop, take carbs, and wait when hypoglycemia goes away. It usually takes 5 to 15 minutes. Then check the glucose level again. Make sure there's no hypoglycemia, and go on. Then, after the exercising, especially if it lasts too long, as we see with the long bike rides, the glucose level may keep dropping after exercising. Therefore, you should follow it up for some time. Usually, a person has a common response to physical activities. If a person knows that their blood glucose level keeps dropping, even after the ride, they may choose an adequate regimen.
Thank you, Mr. Filipov. Now I know how cycling can be healthy.